Critical care last-minute flashcards. Child sustained blunt trauma to the abdomen. All vital signs are normal. The abdominal ultrasound is positive for splenic rupture. What is the best management? For hemodynamically stable grades 1 to 3 of splenic rupture, conservative management with monitoring of vital signs, surgical consult, serial hemoglobin and hematocrit measurements. Child presents to the emergency department with rapid breathing, low blood pressure, normal oxygen saturation. On exam, you find tachypnea, tachycardia, clear lungs, but muffled heart sounds, and wide pulse pressure. What is the most likely diagnosis? Cardiac tamponade. The most important signs of cardiac tamponade are respiratory distress, for example, tachypnea, tachycardia, clear lungs, and muffled heart sounds, plus wide pulse pressure. A 12-year-old girl was transferred to the emergency department after a car accident. She is complaining of chest pain on the left side and difficulty breathing. On exam, vital signs are normal, however, she has fast and shallow breathing. A segment of the left chest moves inward upon inspiration and outward upon expiration. What is the most likely diagnosis? Flail chest. The key words for flail chest: car accident or trauma, chest pain and difficulty breathing. And on exam, the segment or the affected segment will move inward upon inspiration and outward upon expiration. And the best next step is pain control, pulmonary toilet, ensure adequate ventilation and oxygenation. A 5-year-old boy with high fever 104 Fahrenheit for 2 days. He is lethargic, not able to drink by mouth. On exam, he is awake but minimally interactive. Temperature is 104.9 Fahrenheit. He is ill looking, having tachypnea, tachycardia, low blood pressure, delayed capillary refill time, diminished peripheral pulses, and white blood cell count is elevated, is 29,000. What is the most likely diagnosis? Septic shock. The key words for septic shock: signs of shock, for example, tachypnea, tachycardia, low blood pressure, delayed capillary refill, plus signs of sepsis, for example, fever, leukocytosis. This patient continues to have low blood pressure, refractory to fluid resuscitation and antibiotics in the first 15 minutes. What to do next? Start epinephrine infusion. What is the formula used to determine the endotracheal tube size uncuffed for children older than 2 years of age? Endotracheal tube internal diameter in millimeters equal age in years divided by 4 plus 4. This is for uncuffed. If cuffed, will be internal diameter in millimeters equal age in years divided by 4 plus 3. Same formula, but here plus 4 for uncuffed, plus 3 for cuffed. A shortcut for the cuffed one: cuffed ATT size should be half to 1 size smaller than uncuffed. We have one example here for uncuffed and one example for cuffed. For uncuffed, if the child age is 4, the internal diameter will be 5 millimeters. So apply this formula. If the age is 4 years, will be 4 to 4.5 millimeters for cuffed ATT.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the last-minute review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last-Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.